Good morning, everyone. The Senate Committee on Health Care will come to order. I would like to welcome everybody here. We hope this will be the best part of your day. So with that said, I want to recognize our Senate pages. We have several this week in the building. I think we have about half of them are here today. I want to recognize these guys and have you stand up when I call your name. Ryan Corson. Is Ryan here? Hey, Ryan. And Ryan is from Cary, North Carolina, sponsored by Senator Adcock. Pay attention, I'm introducing your page over here. Mackenzie Finney, Sanford, North Carolina, sponsored by Senator Bergen. Welcome. Will Harris from Smithfield, sponsored by Senator Sari. There you go. Thank you, sir. And we have Olivia Matthews from Clinton. Olivia, welcome. She is sponsored by Senator Berger. Miller Switzer from Weaverville, sponsored by Senator Julie Mayfield. And last is Thomas Taylor from Pinehurst, sponsored by Senator McGinnis. So thank you guys, welcome, glad you're here, and hopefully this will be an entertaining week for you, and we hope you learn a lot and have a good experience. I'd also like to recognize our Sergeant at Arms, John Enlow. John, glad to have you. Dean Gustafson, ever in the back, and then Mike Harris. Mike, how you doing? And then Sherry Hedrick is over there, Sherry, and Matthew Lee. Thank you guys for being here. Folks, we have one bill on the calendar today. That is House Bill 287. It's a Health Care Omnibus bill, and I'm going to recognize Senator Bergen to present the bill.
Thank you, Mr. Chairman, and I need to send forth an amendment, and I think everyone's got it.
Okay, if you have the amendment, we will take the amendment up first, and Senator Bergen, I will recognize you to explain the amendment.
Yes, sir. It just does a couple of things. It goes through the education hours. It rewrites the rehabilitation facility that we talked about, and thank everyone for your comments and all the information that we discussed. And then it adds a section about the Eastern Band of the Cherokee Indians, and I'll be happy to, I think the chair will be discussing that, but I'll be happy to answer any questions.
So the chair will discuss the second part. This is a provision I've been working on very closely with the Eastern Band, Via Health, and DHHS. Basically, the Cherokee Indian Hospital in my district is a very large facility for the number of people. It serves 14,000 people that are part of the Eastern Band of Cherokees. There is an interstate agreement between a number of states where we can share hospital beds across state lines. And so we felt like the hospital, as well as others involved, DHHS, felt like we need to have a written agreement with the Eastern Band. They have a larger hospital than they need. They overbuilt by their own admission, which is a wonderful thing. If you've not been there, it's a beautiful facility. But they have and this is especially for mental health, they have, I believe, 18 beds. And I visited there 3 times, and I think the most folks I've seen there is maybe 2 or 3. So they have availability there. So all this does is just allows the Eastern Band to make those beds available to citizens outside of the membership of the Eastern Band. And I'd be glad to answer any questions about that. Any questions about the amendment? Seeing none, all in favor of the amendment signify by saying aye. Opposed? That motion passes, and we're back on the bill. Senator Bergen.
Thank you, Mr. Chairman. I do want to just go over a couple of things. First, this amendment incorporates feedback from last week's committee meeting on the CO and provision. The amendment is now narrowly written to address inpatient rehab beds. Skilled nursing facilities are not included in this bill, and the change to the definition of rehabilitation facility to mirror federal CMS rule further clarifies that skilled nursing is not included in these changes. I think the chair discussed all the provisions associated with the Eastern Band of Cherokees. I again want to thank Representative Sasser for working with us on this bill, and he's here to address any questions that you have in the earlier part that deals with opioid antagonist, and then I'll be happy to answer any questions, Mr. Chairman.
Thanks, Senator Bergen. Any questions from members about the bill? Senator Adcock.
Thank you, Mr. Chair. Senator Bergen, I don't know if the rest of y'all have, I guess you have, gotten the same couple of messages I have, questions about the family and therapist part, family marriage therapist part of the bill. We're just asking the question and making an assumption that there has to be reciprocity of a license, even if that licensee from another state doesn't meet the same requirements for licensure that our state requires. And I wondered if you could, or if anyone in the audience could offer us any assurance that that's not true. Because while I believe in reciprocity, what I know about nursing anyway, is that you still have to meet the same standard for education and all that jazz. So if somebody could speak to that, I think that might be a reassurance.
Senator Bergen.
Well, I can't speak directly to if that is exactly right, and there may be someone here that from the marriage counselors. We do actually have someone that can speak to that, Mr. Chairman, if you could.
Okay.
And if I could have a follow-up, and I think what it hinges on is the word shall issue, and whether that shall means you have to do it regardless of whether those qualifications are met.
Thank you. Sir, recognize yourself, introduce yourself.
Yes, sir. Thank you, Mr. Chairman. John Carr, lobbyist, North Carolina Association for Marriage and Family Therapists. The bill would provide for a shall. North Carolina has standards that are different from other states regarding supervision and training, but those standards we believe are different in a way that the other states require more hours of supervision and more hours of clinical hours in order to get a reciprocal license. So on balance, we think that our standards are substantially the same as other states. We have been working with Virginia, Tennessee, Maryland, and Georgia to also enact this same legislation so that we can have the benefit of a informal regional compact, the effect of that. We are not seeking a compact, we're seeking to adjust the years so that there's consistency across the states.
Follow-up, Senator Adcock.
I really appreciate that clarification because I think we all support this. I mean, we voted it up last week and it got a lot of positive conversation. We all want to increase the number of providers out there for these kinds of services. So I appreciate that clarification.
Senator Adcock.
Thank you. Any other questions from committee members? Seeing, hearing none, anyone from the audience want to comment on the bill? If not, a motion will be in order. Senator Johnson has made a motion for a favorable report for the bill as amended, rolled into a new PCS unfavorable to the original with a referral to rules. Is that your motion, sir? Motion's before you. All in favor of the motion signify by saying aye. Aye. Opposed? That motion passes. Thank you. We stand adjourned.